Hi guys, welcome to another episode of Just a Minute with Dr. Sandy. I'm in Finland and it's freezing here and I sit outside the outskirts of a forest so close to nature. So today I'll explain something very close to us, which is in us, which we are using a lot now to heal our diseases, stem cells. So to understand stem cells, just remember the stem of a plant, yeah? So first when you put a seed, the stem grows and from the stem everything comes out. So basically stem cells are cells in our body which can differentiate or change into whatever is necessary in that region. Or they are cells which can just be concentrated in order to heal any inflammation or any injury in that region. Now these are of two types. One is called platelet-rich plasma. So platelet-rich plasma is nothing but your blood taken, its healing factors concentrated in a sterile way and injected into a region which is injured or is inflamed. Commonest is lateral epicondylitis, tennis elbow or any foot pain, plantar fasciitis, heel pain. So for conditions like that, PRP is used. The next one which actually gives the meaning to the word stem cells is mesenchymal cells. So mesenchymal cells are actual stem cells which are either taken from your fat or from your bone marrow. That's very simple. So if they are taken from your bone marrow, they tend to form bone cells better. If they are taken from your fat, it forms soft tissue better, like cartilage or tendons or ligaments. So simplifying all this, stem cells are basically cells which are there in your body. They were always there. Now we have techniques and technology to harvest these cells and use them in other regions of your body where they are needed. It is just that. And with stem cells, depending upon what the injury is, these cells decide to form either cartilage or tendons or ligaments. So your body is choosing what to heal on its own. That is the greatest advantage of regenerative orthopedics, where we use your cells to heal your diseases. Thank you very much. I know this was a little more than a minute, but it needed that. Signing off, be safe, be well. Dr. Santhosh. Bye.